Hey, everybody, it's David with Highway to Health podcast series. Thank you for joining us. And, if you've tuned in the past, you know how excited, passionate I am about telling the stories of providers, solutions, even patients sometimes, about this open road journey that we're all on to improve access, experience, and outcomes for our patient and provider community. And if you've been to a trade show, if you've been to an event, if you've taken any kind of continued education over the course of 2023, you know that the biggest topic in healthcare right now is health equity. Today, we're going to look at health equity through the lens of philanthropy. And that's why I'm really excited, honored to have the CEO and founder of Atlas Health, Ethan Davidoff, on the show today. He's going to share a lot of things with you. We're going to hear some stories. Ethan, welcome to Highway to Health.
Thanks for having me, David.
I'm glad you're here. Last time we saw each other was at HFMA, and every conversation that I had, it almost started and ended with health equity. And so I'm excited to hear a little bit about Atlas Health, about what you're seeing in the industry. But before we get started, you probably know by now, but I ask all of my guests, especially the executives with busy schedules, to share with our listeners maybe a healthy habit that you've built into your busy routine to maintain that physical or mental health that keeps you, available and ready for the communities that you serve. You mind sharing?
Absolutely. So every morning I get up very early and I go take a walk outside just as the sun is coming up, just as at the first break of day. I find getting outside and walking around, getting that oxygen, it gives me both the physical and mental energy and acuity to really attack the day. So that it's a small thing. It's a 45-minute walk around the neighborhood, but I find that it energizes me and we can get a lot more done and help a lot more patients.
There's something, I love being outdoors. First of all, that's a big part of my routine as well, but there's something about seeing the sun up and seeing the sun down. The sunrise and sunset it's pretty special to me. And man, it makes you take a moment and appreciate a lot of things, but especially this beautiful creation that we're all a part of.
Absolutely. Yeah.
I appreciate you sharing that. Atlas Health focuses on what we're going to talk about today, philanthropic aid. Just so that our listeners are on the same page, there's probably a couple different ways we could define that. But, in the terms of Atlas Health and the things that you guys do every day for our provider and patient communities, define that term for us. In your words, what is philanthropic aid in the healthcare system?
So philanthropic aid represents the tens of thousands of programs that are available to patients that are not eligible for traditional safety net government programs to cover their medical expenses and other related financial burdens that can occur and be associated with a complex disease. In total, we've cataloged close to or a little over 20,000 programs that represent over $30 billion in annual dollar value, that cover the cost of procedures, the cost of medications, the cost of transportation and lodging related to receiving care in clinical trials, dollars that help towards paying insurance premiums for eligible patients, and so forth. And so, given the overall challenges of our healthcare ecosystem as it relates to affordability and health equity, these dollars, for many of us, can be the difference between life and death. And I'm specifically referring to patients that get cancer and have to make a very tough decision about whether they can even afford the chemotherapy, whether they're willing to go through it, knowing that it could bankrupt their family, force their spouse to sell their home. And most people in this country are living, paycheck to paycheck. They don't have tens of thousands of dollars saved up in their bank account assuming that they're going to get a serious disease and need high cost treatment. And so really, philanthropic aid is the true safety net that's really emerged over the last 15 years or so and has really been accelerated given some of the cost sharing to the consumer. It's kind of happened as an unfortunate result of some of the legislation that was passed in the early 2010s.
Touching on a really important topic here, which has to, I would imagine, without making too much of an assumption, I would imagine that this has got to be a part of most, if not all, core initiatives at the provider community right now because of what you just mentioned, which is rising patient responsibility and the ultimate financial toxicity that some of these patients with some of these severe diseases are experiencing. And so talk through that for our listeners for a little bit. How does that align with health equity, and why is that important when having conversations with the provider community right now, especially when aligning with, these executive initiatives that all of our providers have?
Yeah, it's a great question. So I think that you got to look at this in a few different dimensions, right? On one dimension, let's just call it the business dimension. At the end of the day, we're all running businesses. We are delivering products and services. And if we are not paid for our products and services, then we're going to go out of business. We can't keep the lights on, right? So inherently, from a provider standpoint, they need to get paid or they're going to go out of business, right? That somebody's got to pay that bill. Whether it's the patient or somebody else, they have to be reimbursed for the care that's delivered, right? And so I think on that side, there's a very straightforward, reason to engage in figuring out strategically how to scale and optimize their own philanthropic aid programs at hospitals, health systems, and other provider networks. I think we talked a little bit about patients, and the goodwill towards patients cannot be underestimated. All of us work in healthcare because in some fundamental way we care about our fellow human beings. And literally these access and affordability challenges related to the financial burden, and whether it's after the fact trying to reconcile a bill or before you even get treatment, this assumption that you can't afford healthcare and that stops you from going in and to get checked out and then waiting for it to be too late. And now you're stage 4 instead of stage 2. And now you're likely to die. Like, these are real things that happen, real choices that people are making because the perception that healthcare is unaffordable and that there's nothing out there for them. They can't cover that co-insurance if they have insurance or they don't have insurance, right? But when it comes to health equity, I think that the third dimension, with health equity, there's a lot of different terms for it. But for me specifically, this is about leveling the playing field, regardless of socioeconomic status, gender, race, ethnicity, regardless of who you are, we all deserve the same level of care. It's a fundamental human right. And unfortunately, just the way that, the world and society and our country has kind of progressed, there are inherent disparities in the level of care that people perceive. And a big chunk of that, right, is related to this financial toxicity and financial burden. And so really what philanthropic aid accomplishes on the health equity front is it levels the playing field. These programs are available to everybody who's eligible, regardless of, again, socioeconomic, gender status. It's meant to level the playing field. And I think it's early days, but we're in a position to actually demonstrate that we're advancing health equity by showing where the aid is going, who's getting the aid. It's going to the right people that need it the most. And I think that's really what's powerful, about philanthropic aid, what we do and what others that work in the philanthropic aid space do, is we're making a real impact on people's lives, sometimes even the difference between life and death. And then more broadly, we're impacting at a macro level, doing our part to advance health equity and make our country more, just more fair.
Yeah. Yep. I couldn't, we're touching on both sides of the business here, the experience and access for the patient, talking about the revenue cycle and the reimbursement process for the provider. Let's continue down this access and experience side of what you guys do with philanthropic aid. Somebody on this show not too long ago talked about innovation means nothing unless there's wide-scale accessibility to that innovation. We're living in this golden age of innovation in healthcare, and in almost every facet, in therapeutics and treatments, and in different locations of rendering services, all the way down to, the innovations that are happening in terms of digital health and digitization of the revenue cycle and automation of the revenue cycle. But none of it matters if it's not accessible to the majority, if not everybody, that need access to that innovation. And so let's continue talking about how philanthropic aid provides access for these folks, because we're not just talking about the cost of therapy. We're talking about the cost of, like you said, taking off work, traveling into the provider. Maybe that's a long distance, right? For our rural communities. What kind of education, what kind of information is out there for these patients to start learning more about the choices that they have? And how can we make, philanthropic aid more accessible to the community, the patient community at scale?
Yeah, it's a great question. Well, a good start is podcasts like this, right? And the great work that you're doing to bring visibility and awareness to a much wider audience that this type of innovation exists and it's emerging and it's out there. And it's out there for providers and for patients. And so I think there's a lot of emerging organizations, not just our own, that are raising the bar in terms of overall awareness. And, maybe, and it can go as far as I'll reference a company I think that's been in the news quite a bit, is RIP Medical Debt. And it's a good example where they've made a lot of noise to, and gotten notoriety that, hey, wait a second, there's other ways to resolve patient balances than hounding a patient who doesn't have the money to pay for it, the income, the assets to actually pay for it. So I think that there's general awareness. It's one dimension. I think the next part is really working with the hospitals, the health systems, the providers to help them understand how this is a strategic program that is worth the investment to scale, in that it checks all of the boxes between business, health equity, patient experience, reducing total cost of care, improving outcomes. And I think we're still early days in that journey, as this still is a relatively nascent thing for providers. But I think that us and probably our peers and other organizations that do what we do are kind of leading the charge to make this more visible. And the reason that's important is that patients don't need to seek out philanthropic aid unless they're in big trouble. Right? These programs, this money was really set up for patients with complex disease, on high-cost therapeutics, life and death situations, quality of life situations. This is a special pool of money to solve a very important, problem. And so I think that by the work that we're doing, all of us, in terms of raising awareness through case studies and white papers and webinars and podcasts, and bringing the right people together, and tying it to real substantial corporate business objectives is the practical way that we're going to, really make change and bring this to the forefront.
There has to be alignment there. There has to be alignment in terms of access and equity experience for the patient, but also the business aspect for the provider, because of the reasons that you mentioned earlier in this podcast. It's, in some ways it's no margin, no mission. You got to keep the doors open. And philanthropic aid, especially in these, critical cases, seems to bridge that gap and make those ends meet for both of those communities.
Yeah, if we go a little bit deeper into, health systems, I think one of the challenges that we've learned over the years is that what philanthropic aid is and what it means for a patient, it's not only a revenue cycle finance collections thing. It's clinical operations, it's pharmacy, it's IT. So it actually, because it's a still a relatively nascent concept, what we've seen is different groups within a large health system organization with different P&Ls and potentially different, incentives and structures, where something nascent like philanthropic aid potentially there may be coordination gaps across these departments. And you kind of take that reality and you couple it with the challenge of how many programs are out there and how different they are with regards to eligibility and applications and reimbursement processes. And then you think about the data silos within the provider walls and outside, and back to, the different groups. And you have a very challenging initiative to optimize. And so it's worth scaling and optimizing from a financial perspective, from a patient experience perspective, from a health equity perspective, from an outcomes perspective, et cetera. But that alignment that you're hitting on, that's a lot of the work that us and our peers that's the hard work. The day-to-day work is bringing all of these diverse stakeholders together, not only, to solve this at all the different levels within an organization, ultimately backing into helping patients and advancing health equity.
Most of my career has been in sales, and the adage is you confuse, you lose. Well, in healthcare, there's just a ton of confusion, right? The patient doesn't always understand what options are available to them. Sometimes there's too many options, and it's overbearing, it's confusing. And so, that analysis causes paralysis. Well, the same thing can happen on the provider side, where there's a lot of noise out there, and providers are always being shown, demoed, all of the great, awesome solutions out there. And sometimes there's fatigue caused by all of that noise. The same can probably be said when you have a lot of these different programs that are offering philanthropic aid for the provider to help cover some of these costs. I can imagine there's probably some confusion and some paralysis by analysis from the provider. And while we're talking about some of the biggest topics in healthcare, like health equity and access to care and all of these things, we may as well talk about AI and how artificial intelligence is helping automate and streamline some of these decisions being made at the provider. AI, how's artificial intelligence helping Atlas bridge this gap and take away some of that confusion by that's happening at the provider?
Yeah. So a little bit of background. at my previous company, before starting Atlas, we were big early adopters and proponents of machine learning, a type of AI that's applied to very hard, intractable problems to, at the end of the day, increase the probability that you're making the right guesses, if you will. And so seeing how that worked firsthand at my old company, when we first started to learn about this problem and go very deep with the market and understand the challenges, the pain points, it was very clear that what everybody was doing was just hiring people and doing it manually for some of these reasons I said about thousands, tens of thousands of programs, data silos. And so there was no automation at all. And when we started to develop the software and think very carefully about exactly how we could automate as much of this workflow as possible so that from a business perspective, you could really scale it up and help every last patient, capture every last dollar and help every patient. That's the goal. Help every patient with every program, right? And I think what happened was in those early days, we realized that in certain aspects, you're not going to ever get to 100% automation and 100% knowing this person is exactly eligible for this program at this moment in time for this upcoming procedure, and it's going to pay this amount, right? And so we knew that getting precision to 100% ahead of time was not possible. But that's when we realized that in addition to a rules engine, that AI, specifically machine learning, could be leveraged to provide much more predictive analytics and predictive capabilities so that the entire universe of patients could be matched and enrolled and reimbursements could be captured in a much more efficient manner, frankly, that would map back to really running a P&L and justifying the expense side of this, right? It does take a village. It's not an easy problem to solve. So that was really our first approach to leveraging AI as we were building out Atlas. And it really snowballed to all different parts of our business. And the next application for us was, well, how are we going to keep track of tens of thousands of programs and all the changes that are being made? And some of them there's the changes that are made daily. How are we going to keep that up to date so that our algorithms and our matches are fresh and we are, again, solving that problem of having the right matches to the right patients, the right programs, the right time, when dollars are available and when they're not available. And so we leverage a different aspect of AI, which is most colloquially known as robotic process automation, but very smart web crawlers and automation to keep track of all these programs. So that's another application. I think my final thing about AI, and I think it's been more exciting probably in the last year or so, is with GPT-4 and large language models really becoming commercially off the shelf available as middleware to be leveraged. I think what we're seeing is that from a patient experience perspective, there's an opportunity to leverage prompt-based behavior, more unstructured communication and text to more efficiently engage patients and steer them towards the right programs and opportunities that can provide philanthropic aid and make an impact as it relates to access and affordability challenges. And that's more of a new thing for us. It's still a roadmap item, but we just continue to be very encouraged by all of the innovation going on in AI and being very thoughtful about how we leverage that into our DNA to make ourselves as a company work more efficient, but also to marry it into our product and our services to really serve as a differentiator in the market, as well as really having better outcomes and results when it comes to patients and the dollars that we deliver.
I don't want to put you on the spot here, but in addition to, the aid that helps get these, bills, these claims paid at a higher rate, in addition to reducing the financial toxicity and patient responsibility in the patient community, is there something else that the provider community benefits from? Is there a rating or a score, some sort of metric that when they provide more philanthropic aid, if they make the connection between, program and patient at a higher level, is there some sort of program or, score that improves for that provider, with CMS or a different organization? Is there a different kind of evaluation that these providers are trying to meet and improve on?
It's a great question. And this is definitely an area where that's very ripe for innovation. So, and the short answer is yes. The first example relates to CMS and the annual Medicare cost report, CMS report that providers publish. And within that report, there's a section called the S10 worksheet. And this is related to, frankly, charity care and how the health system is demonstrating how they're giving back and helping those in the community that are underserved. And the levels of, to oversimplify, the levels of charity care and what's given ends up impacting reimbursement rates for that specific hospital or health system from CMS in future years. And so a very common example of this is Medicare bad debt. It's as part of this. There's a certain percentage that comes back from CMS. So from a revenue integrity perspective, when you think about the current state of that Medicare cost report and philanthropic aid, we've seen some opportunities to leverage philanthropic aid as a nouveau form of extended charity care. And so that's an interesting opportunity that I think it's early days, but we think is an opportunity to lean into, for health systems, frankly, and how just another part of the value proposition. Now, a second dimension to your question that I think maybe gets lost here a bit, and I don't think there's a formal rating board for this, David, but I think it's critical. It's really the reputation of the system itself. If you go on any hospital health system website, you're going to see a pattern. Their mission is to serve the community, right? This is why we can't let our hospitals go bankrupt, because they can't pay the doctors, they can't pay the equipment, they can't keep the lights on, right? They're there to serve the community. Where else are you going to go when something bad happens? That's where you go. You go to the hospital. So what this means is that they have a mission that they need to live up to, but they also have a business challenge of needing to collect dollars. And I think we've probably all seen enough, horror stories or sensational headlines in the news over the past few years about aggressive debt collection, hospitals taking aggressive debt collection practices against underserved patients. And really, that's just one side of the story. They're trying to keep the lights on and feed their families too. And so when you think about philanthropic aid, what an amazing opportunity to solve that cash collections issue while also really living their mission and enhancing their reputation in the communities they serve. And so I think it's an interesting part of the value proposition that it's hard to quantify. There's no industry board. But I think more and more there's a big opportunity here. And it frankly ties back to your earlier question about awareness and how do we extend access to philanthropic aid. I think this is part of it.
I couldn't agree more. The there's just some negative perception about healthcare in general. It's one of the reasons why I started this podcast. The negative perception sometimes is, well, it's, healthcare is so behind in terms of technology and innovation. Well, not always true. And if it is, there's probably a really good reason why. There's also this negative perception about providers that, for some reason, those that haven't been in healthcare for a long time as a career, they think, they see these big, beautiful buildings that these hospitals have, and they get the big bill in the mail, and they go, the hospitals charge me $12 for a Tylenol. They're making a killing on me. That's not necessarily the case. Now, are there exceptions? Maybe. But as you said, most hospitals, most providers, their mission is to serve the community. But they're stuck in this balance, in this trade-off of running a business and providing great experience. And that reputation matters. Perception is reality in a lot of ways. And I see philanthropic aid being a bridge to a lot of these things, and we can't negate or diminish how important the perception and reputation is, especially for that community. I live in a rural community. We don't have many options in terms of where we go for care. And when healthcare is really needed, where are services rendered? It's locally, right? You go to the place that's closest to you. And that perception matters to that community, which then translates into either less of a business challenge for that hospital, for that provider, or a bigger one. And so you're right. I can imagine how hard it would be to quantify, that perception or reputation improvement, but it's absolutely a factor. And I see this as one way to really, serve the community at the level that, they had a vision of when they set their mission. So I appreciate you sharing that. We've talked about AI, we've talked about revenue cycle, access, equity, philanthropic aid, talked about a lot. If our listeners could walk away understanding one thing today, if they could walk away remembering one piece of our conversation, what would that be?
It's very easy to get started with philanthropic aid and understand how big of an opportunity it is for your specific organization. So over the years, we've refined our algorithms to come up with a very lightweight assessment to analyze a health system's data, hospital's data, and size the opportunity and give the health system transparency and visibility into where are all the pockets of cash and reimbursement, and really surface that against their current state program, so that if there's a delta, right? If patients are slipping through the cracks, if money is being left on the table, that they have an opportunity. Whether they work with Atlas or another company, that's their choice, right? But at least by giving the organization the visibility and the transparency, that's, I think, the main takeaway. It's very easy. It's a lightweight process. And we do it. We don't charge for it. We do it for free. So I think that would be the main takeaway if for folks that are, working at the health system, whether it's revenue cycle, finance, pharmacy, cancer, or clinical operations, you name it. I think, that's kind of the big takeaway here, which is it's easy to take a look. It's not much lift. And, then you can decide what's best for your organization from there.
Education is powerful. And why wouldn't these providers, become more aware, more educated on the opportunity that's out there to improve access, to improve experience, to improve outcomes while running a successful business? And so I would echo that encouragement of why not, especially if it's a light lift and there's no cost associated. So thank you, Ethan, for being here. Thank you for sharing your story and the story of Atlas, Philanthropic Aid. You're welcome back anytime on Highway to Health.
All right. Thank you so much, David. It was great to be here. Take care.